Welcome to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And in this case, we're talking about Innovate Memphis. We're honored to be joined by their Chief of Staff, Courtney McNeal. How are you doing, Courtney?
Hey, Jeremy, I'm doing well. How are you?
Doing well. You all do so many amazing things for our community, and so it's fun to have you come on talking about the ways that you are able to innovate, and we'll talk about that in a second. But we have one focused on transportation that we're going to talk a lot about today. So let's go ahead and start with some context. For those who aren't familiar with Innovate Memphis, give us a little bit of context around your history and your efforts.
Yeah, absolutely. So Innovate Memphis, we started off back in 2011. We were actually a part of city government, what a lot of people don't know. We were under the Warren administration through a Bloomberg grant when he initiated his I-teams. And so we were one of the first of the 5 I-teams that was implemented across the U.S. But we were in the mayor's office, and then after our time there, people still wanted to see our work done in the community. And so people invested in us, and we roll off into our own 501c3. And so we've been around for some time, and you can look at us as like the dot connectors between public and private sectors to create tactical strategies and collaborative efforts to seek ways to improve the community. So we identify various civic challenges and try to bring about innovative solutions.
And I think that's the way that, to me, I've always looked at you all as problem solvers. So looking at, okay, how can we kind of navigate the things that the government could do, but in reality has a lot of bureaucratic issues or has some, obstacles, and figuring out, okay, public, private sector, government, how can we bring all these things together to ultimately create movement, to move the needle? And you all have come up with some really creative solutions to drive positive change for our community. So give us a little bit when you talk about some of the things that you all have been able to implement and focus on, and we'll talk about 901 RideChoice in a second, but some other things. Give us a little bit of a landscape for some of the other projects that have been on your plate.
We've done a lot of work around emergency medical services, which kind of overlaps and flows into 901 RideChoice, which we'll talk more about. But before we get to that, we worked alongside with Memphis Fire Department and Emergency Services to develop, programs to address challenges in emergency health care. So the Navigator and Radar program, we helped them pilot that program. And then, of course, 901 RideChoice. We've done a lot of work in parks and public spaces as well. So we've helped the Civic Commons develop its initiatives, and also with parks, the city of Memphis parks. And now we're heavy on research and data, but it seems as if now we're kind of growing and moving into that space and serving as a data hub through our new data initiative. So you all can be on the lookout for that in the future. But we've also done work around transportation. A lot of people are familiar with Memphis 3.0. And so we were heavily involved in that, as well as we kind of assisted leading the engagement and outreach portion on Memphis 3.0 transit vision. And we do a lot of work around housing, just a lot of great things. And so that was just a few things we've done in the past.
Goes back to solving problems creatively with innovation in mind. And so let's carry this into 901 RideChoice. Give us some background on what led you to launch 901 RideChoice, and then we'll describe it. So give us a little bit of context around the background for launching this initiative.
Yeah, so what people may not know is that, looking at things internally with 911 emergency medical calls, they have a lot of frequent flyers is what they call them. So people who will call 911 and it's really not an emergency. And so to address that, issue there, it's like, okay, why don't we offer an option to where people are seeking transportation to leave the hospital they'll have this number and they can call and get connected. So that was one of the things that kind of forced us and led us to 901 Ride Choice. And also, just in general, just thinking about the aging population and persons living with disabilities and how they don't have the means or connections to, to reliable transportation to get to and from not only just the hospital, but just any health related type of appointment or matter. So addressing that, and we all know that, the aging population is kind of a overlooked population. So we definitely want to be inclusive and, highlight that population and getting them to and from, and just allowing them to regain their sense of independence as well. So that was another thing. And also just thinking about how many transportation providers are in the city of Memphis and people aren't aware that they exist. So it's kind of a value increase for local transportation companies who are initially implemented into our inventory.
So go ahead and describe 901 Ride Choice.
Yes. So backing up, so 901 Ride Choice, when we launched, it served as just a resource, right? So it was a free telephone number that people can call to get connected to reliable transportation. At that particular time, we weren't like subsidizing rides or anything like that, but it was just a way to get information out. Even if you had insurance, still connecting you to those providers. And it was interesting because some people will call and had insurance, but did not know that they had the benefit of taking advantage of free transportation. And so, that was another thing that we were able to connect. But here recently, we are so fortunate to receive support and funding from various partners to offer subsidized rides. So we recently wrapped up a program, Rides to Wellness. Yes, so it's free non-emergency ambulatory rides. We did get that funding from the city, and we connected aging residents to non-ambulatory transportation at no cost. We also partner with LISC and Uber Health. We did rides to vaccines. So if people are interested in getting transportation to get the vaccine or anywhere where they can get information related to the vaccine, the ride was free. So it's a win-win. Like, okay, I need to go get groceries. There's a pharmacy in the grocery store. I'm gonna pick up medicine. They also have information about the vaccine. I'm just gonna make this a thing. So it pretty much worked out. And then now we are moving into our second program with sponsored by LISC and Uber Health, Rise to Resources. So that particular program is open to anyone. You have to be 18 or older. We're still focusing on the aging population, but it is available to everyone. So basically getting you to places that impact your overall quality of life, just focusing on those social determinants of health. And that could be physical, mental, spiritual. So you need to get to church. We can offer you a ride to church. You need to go to the grocery store, the doctor's appointment. So that program is in place and it will go into the end of this year, December.
How do you all manage need? So in other words, when you look at this, is it across the board open access? Is it really designed obviously for those who need the help the most? And so talk about how you determine need and if that even factors in at this point.
Well, at this point, it really doesn't factor in, but initially started off, we did kind of have like eligibility requirements, but the interesting part about it at this point, we really don't factor the need because in general, we know it is a need, like in Memphis, just across the board, whether it's to get to health appointments, whether it's get to work, like transportation, is a barrier to a lot of our residents. We've understand that. So that's why we're so fortunate to have this program that's open to everyone. And we do collect a lot of data. So hopefully at the end of this, we can go back and observe and evaluate that data and can really, really implement some things and saying, you know, it's a need for this demographic or people living in this area, and possibly partner with, you know, our good friends at MATA. They're great. And, you know, they're working very, very hard to get things in place, and maybe share that information with them as well.
Talk about how it works in terms of scheduling the rides. So give us a little bit of the process.
Absolutely. So they'll need to give us a phone call at our call center, our call representative. And the number is, the easy way to remember the number is 901 ride 901. But give us a call, and then we'll just go over, you know, a series of questions, again, capturing that data. Go over a series of questions and put in your trip information, your destination, all that. We do, though, recommend, what we strongly encourage people to call us maybe 2 days before their appointment. So if you know you're going somewhere in advance, it would be very helpful if you call us in advance to just get that scheduled. And, you know, you don't need a smartphone. It is an Uber service, but you don't need a smartphone. You could just give us a call. And our call center reps, they will be happy to navigate everything and get you connected to your driver. A few things to know about it, though. Calling between 9:30 and 3:30 weekdays. So that's another thing. I mean, if you call a little bit after 4 o'clock, someone's always around, but we're trying to keep it between 9:30 and 3:30 to get everything just streamlined. And also, you have to be a resident of Shelby County. So that is, but the great thing about it is you don't necessarily have to stay within Shelby County in terms of like where you're going. So long as you're a resident and you have a doctor's appointment in South Haven, we can get you there. So yeah.
I'm glad you mentioned, though, you know, when you talk about just Shelby County, you know, basically the office kind of hours, if you will, during the workday, a couple of days in advance to get scheduled, that this is not an immediate, you know, hey, I need it right now. It's like, hey, this is all scheduled out in advance. Very important knowledge for everyone to know so that everyone can be effective and efficient in terms of getting everyone where they need to go and doing it, all the proper procedures. So talk about kind of your vision, you know, as Innovate Memphis, of where this is headed. So as you mentioned, collecting all the data and figuring out, okay, what's really working, what's not, how do we continue to innovate? I love the approach you're taking where it's like, let's try this, let's figure out where everything goes, and let's make sure that we're, you know, doing all the right things. Where do you see all this headed?
That's a great question. So essentially, kind of what I touched on, collaborating with partners to see how this can sustain. So historically, Innovate Memphis, we do not house projects and programs like we're doing now. Like, so the idea is to, you know, identify, it's like incubate it, you know, test it out, and then see where it can live and be happy elsewhere. And so that was the idea for this. This project has been around like right before COVID. So typically a little longer than what we typically, you know, do in terms of sustaining programs. So that's the phase that we're in now, just trying to see how can this live on and who can, you know, sustain that. So we definitely want us to be around forever. It's a great program. So that's what we're currently kind of trying to figure out.
Yeah. Well, and that leads us into the next question, which is how can the community help? And so obviously for organizations that say, this could fit into our portfolio of our services, you know, that's an easy, obviously, parlay over in terms of opening that dialogue. But how else can the community help Innovate Memphis?
At this point, honestly, if they just want to spread the word about this program, I'm just super intentional about getting this to as many people as possible. And you know, we're a small team but mighty, and you know, we do it, you know, a lot. You know, we do the best that we can with sharing the resources. But you know, when we started 901RideChoice, we had a lot of community partners. We consider them like marketing partners. So like they'll share with their direct networks, their targeted demographic and whatnot. So if people can just spread the word about this, they're welcome to email me. I can send literature, collateral to them. But that's essentially where I am now. And, email me if you have ideas of sustaining, how to sustain, open to that too. Not saying that we're going to roll with it, but definitely open to it, but definitely spreading the word.
Well, last question then is the easiest of all. Where do we go to learn more about Innovate Memphis and 901 Ride Choice?
Absolutely. So you can go on our website. It's super easy, innovatememphis.com. On our website, you should be able to find information on 901 Ride Choice, or you can just find us online, 901RideChoice.com, and all the information will be there. Also, to just contact the contact center directly, call 901-743-3901 or 901-RIDE-901. But again, 901RideChoice.com, InnovateMemphis.com, and it's all.
Makes it very easy. Courtney McNeal, Innovate Memphis Chief of Staff, thank you for all you and your amazing team do. Thank you for coming on the show.
Thank you for having me. Thank you.